Hi, I'm Dr. Kurt Woeller. Well, it's that time of year again. Spring is upon us, and for many kids on the autism spectrum, spring brings on yeast. Now, it's interesting, I've seen this pattern over the past many years where kids who are susceptible to yeast overgrowth, or they have a yeast overgrowth issue, and it's been well controlled, whether through supplements or medications, all of a sudden spring hits, the pollens are out, the flowers are blooming, and all of a sudden kids start to regress into yeast behavior. The goofiness, the giddiness, the silliness, the inappropriate laughter, the self-stimulatory behavior, just odd types of things that we often associate with yeast overgrowth come about. Now, why exactly is this happening? It's pretty difficult to know exactly what's going on, but the suspicion is that when you have an increase of allergy in the body, you obviously have an increase in immune activity to those allergens, whether it's a pollen, whether it's a grass, whatever it may be. If you have an underlying yeast issue with your child, then essentially what's happening is there's a bit of a shift that's occurring in the immune system, whether it's systemically or localized into the intestinal tract or the mucosal lining of the sinuses or the nose, but it has a systemic effect. Once there's that increased immune activity in some respects, the yeast can take advantage of that type of situation, and many times they start to overgrow, and as they overgrow, they increase their metabolic activity, their biotoxins are released, and kids just start to cycle again into yeast behavior. So some things that you can do is, first off, watch for it. You know, if you're in a part of a country where all of a sudden it's pretty cold and all of a sudden it's getting warm again real quickly, watch to see if you're seeing any type of yeast behavior. Make sure, too, of course, when the weather gets warmer, many of us are outside, we start having family and friends over to the house, we're starting to do more picnics, and many times that can be an increased consumption of sugary foods and juices and soda pop and whatnot for some kids. So that may need to be curtailed. The other thing is you can do some different types of supplements to help. If your child is susceptible to allergies, things like vitamin C, stinging nettles, bromelain, quercetin, and acetylcysteine can be helpful. New Beginnings Nutritionals carries something called an A&I formula, which is an allergy and inflammation formula. So you can go right to their website, order that, and has dosing recommendations right there. That could be something that can be used not only for acute allergies, but for maintenance therapy too. If yeast is occurring, then of course doing the things that we know for yeast, prescription-wise, nystatin, diflucan, Lamisil, Nizoral, etc. Of course, you need a prescription for those. Or there's natural remedies too. Again, New Beginnings carries a yeast formula packet, which is a combination of 4 different remedies. You can rotate anywhere between 5 to 10 drops twice a daily for 5 days and rotate through those different supplements. Grapefruit seed extract, 5 to 8 drops 2 to 3 times a day can be helpful for yeast. Candex is another type of supplement. It's an enzyme that helps to break down the cell wall of yeast. There's a combination of things. I tend to see good results with things like grapefruit seed extract and the yeast formula packet that New Beginnings carries. If the supplements are not holding the allergies, then sometimes even just a short course of an allergy medication, Claritin over the counter, can be helpful. Singulair as a prescription can be helpful. You can talk to your pediatrician or family physician about that, even if it's just for 4 to 6 weeks to get through the real intense period of spring. So again, spring can bring on yeast behavior. I've seen it. I'm already seeing it again this year. Just be aware of it, okay? Thanks.